Hello, Dr. James Bogash, expert in health and longevity, and is a practicing chiropractor who treats lots of low back pain patients. This particular article really rings true with what I see in practice. The challenge is that chronic low back pain can be quite the issue. What I always tell patients is there's not any single intervention, there never will be, that will get somebody out of chronic low back pain. It's not like this injection or that adjustment or that drug or this exercise will help. It is all about a multimodal approach. You have to hammer it with everything else, and a huge component of that is you. You have to be moving. There is no case of low back pain that's going to get better if you are not moving. So you can have the wonderful, the best chiropractor on the planet doing the best soft tissue work, and unless you're moving, it's not going to recover. So this article really kind of drives that point home. They looked at 50 chronic low back pain patients. They considered them young. Extension dominant, so basically they'd look up and extending up, more back pain, considered facetogenic, coming from the facets, the joints in the back. For 8 weeks, they did, the control group did standard stuff, infrared, ultrasound, TENS unit exercises. The treatment group also employed or used stationary bike aerobic training. Now, I happen to be a much bigger fan of high intensity interval training. So for me, it'd be 30 seconds on the treadmill or 30 seconds on the exercise bike or elliptical. Break time, another 30 seconds. I typically recommend 10 sets of that. But what they found is the people that added the exercises or exercising, the aerobic exercise, had better outcomes than the standard group. This boils back down to what I always tell my patients. I am a much bigger fan of exercising than I am exercises. So rather than, patients always ask me, like, what should I be doing? Moving. That's the biggest thing. Certainly there's exercises that can be helpful, but I'll tell you that over the long run, people that do better with back pain are not the ones that do their exercises every day. It's the people that are exercising. So I don't care what it is that you're doing, but you have to be moving. And generally those types of exercises for back pain, they may help in the acute, but they're not going to be as helpful in the long run. That's why I want my patients moving. You combine that, in this study they did not, but combine that with chiropractic adjusting and soft tissue work. I have a huge bias towards adding soft tissue work, so working the muscles, the ligaments, the tendons, the fascia, adding stretching, along with adjusting, along with the patient moving. You're going to have the best outcomes. We are always very consistently see chronic low back pain patients that, 2 or 3 visits later, they're already starting to feel a lot different than they had before. But the ones who respond better are the ones that are moving. I always say that couch potatoes are notoriously hard to fix, and athletes respond much better. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.